Electrochemotherapy is a combined use of certain chemotherapeutic drugs and electric pulses. Local application of electric pulses to the tumor increases drug delivery into cells. Drug uptake by delivery of electric pulses is increased for only those chemotherapeutic drugs whose transport through the plasma membrane is impeded. Among many drugs that have been tested so far, bleomycin and cisplatin found their way from preclinical testing to clinical use. The treatment procedure for electrochemotherapy consists of drug injection followed by delivery of electric pulses applied to the tumor. Bleomycin or cisplatin are injected intratumorally. However, bleomycin can also be injected intravenously. Electric pulses are delivered through appropriate electrodes a few minutes after drug delivery, when maximal drug concentration in tumor nodules is achieved. Several types of electrodes are available from plate electrodes, as in the present case, to needle electrodes, in order to assure appropriate coverage to the tumors with a sufficiently high electric field. Proper choice of electrodes and their positioning with respect to the tumor is crucial. During the application of electric pulses, the cells in the tumor's tissue between the electrodes are subjected to a sufficiently high electric field. As a consequence to this exposure, the plasma membrane of the cells becomes transiently permeabilized, allowing the drug to enter the cell. Pores are then formed on the cell membrane, resealing themselves after a few minutes. During this time, the drug is transported into the cell by diffusion. Increased cytotoxic effects of the drug are exerted by an increased transmembrane transport and drug accumulation in the cell. The effect of the pulses on membrane permeabilization depends on the amplitude, duration, number of pulses, and the direction of the applied electric field. Electrochemotherapy is efficient, easy, and safe to perform. It can be applied under local or general anesthesia, depending on the number and the size of treated lesions and the sensitivity of the area. Application of electric pulses can induce muscle contractions and cause discomfort, which needs alleviation of pain. Due to lack of systemic toxicity, because very low doses of bleomycin or cisplatin are needed, patients can be treated on an outpatient basis and can leave the hospital soon after the treatment. Clinical data collected within a number of clinical studies indicates that approximately 80% of the treated nodules are in an objective response. From those, approximately 70% in complete response after a single application of electrochemotherapy. Usually only one treatment is needed, however, electrochemotherapy can be repeated several times every few weeks with equal effectiveness each time. The treatment results in an effective eradication of the treated nodules, with a good cosmetic effect without tissue scarring.